Hi, I'm Drrodrohrich from Rohrich Knows Podcasts from Dallas, Texas, helping you become a better and more informed you. Today, let's talk about the crooked nose. I get questions about the crooked nose all the time. And the corollary of that is, can you make my nose perfectly straight? And the answer is no. You can make it straighter, better, but never completely straight. Because when you look at us as Homo sapiens, everybody's asymmetrical. My right eye is bigger than my left eye, and my right cheek is fuller than my left cheek. That's normal. And we see these diagrams of the perfect symmetry. Well, they're diagrams. In real life, people are asymmetric, like this woman. She's beautiful, but she's asymmetrical. Even after her rhinoplasty, she's still asymmetrical. She's better. And you can see that her left eye is bigger than her right eye. That's normal. And when I tell people this, they go, wow, I didn't know that. It's normal. It's part of being a human. It's part of your DNA. And you can see this. Again, this is another beautiful woman who you'll see her post-op. She's got a deviated nose, but she's got significant facial asymmetry. That is normal. So all these things are called being normal. And you'll see this woman as well. So how do we get a straight nose? So let's talk about this journey, because the key to a straight nose is a straight septum. So how do you get a straight septum? Well, it's surgery. And this is an article I recently wrote in our journal on the 10 essential steps. And I'm going to break them down for you in a very simplistic manner to show you how you can get a straight nose and how you can find someone that can help you get a straighter nose. And that has to be a board-certified plastic surgeon or otolaryngologist or facial plastic surgeon. And you got to be the same goal-oriented as they are in getting you to look great and have a straighter nose. And that means the nose is smooth, it's got nice dorsal aesthetic lines, the shape is contoured, it's great. But achieving a straight nose, you have to understand what the expectations and the realities are. Everybody's nasal structure is unique, and deviations are sometimes more challenging to correct. And so that's why I wrote this article. And because a crooked nose is complicated, because not only does it affect your appearance, but also your breathing. It can be straighter, but never be perfectly straight. So you can see this beautiful woman that I did a rhinoplasty on. She has slight deviation. She's got significant asymmetry, but her nose is straighter. Is it perfect? No, it's better. It's not perfect. And the healing process, it takes weeks to months to see the final result. And the nose may settle slightly off center as it heals. That's not that uncommon. Even though in the operating room, and I've done 8,000 rhinoplasties, the nose will be perfectly straight. So I'm going to share with you how I get a straight nose in the operating room. So perfection is something you should pursue, but it is not always achievable. Why? Because the nasal dorsum is bony and cartilaginous, very unique in the human body. So even an experienced surgeon can, you'll get a straighter nose, but symmetry isn't ideal. And that's something you should always imprint in your mind. So what are the essential steps for getting a straight nose? It's getting a straight septum. And that's both functionally important and cosmetically. That's very important. And this is a photo of the nasal septum. It's complicated. It's got a septum in the middle, and it's got a bone in the back that's right below the brain, and then it's one above your teeth. That's called the maxillary crust and the vomer. These all can be deviated. So what do you do to get it straight? Okay? The first thing is you got to open the nose. You got to take a look at it. Then you have to widely expose that area. So and I'm going to go through that whole arena where you're going to open the nose, you're going to find the septum, and I call this the Nirvana Septum, because you're going and you're seeing that beautiful whitish hue, and that's where you want to be, because you want to get to the septum and make it straight. And that's the front. And then you want to go and really unroof that whole area and just take a look at it. and make sure what is the deviation. You identify the cause. It's in the front of the nose and the back of the nose. And each of those areas needs to be released and restored. That's very important. The front is by the maxillary crest, by the nasal, by the columella. The back is right in the back of your nose. These all need to be freed up and released. And these are the key principles. To do that is you have to reconstruct the septum. In other words, you have to take it apart somewhat. You have to remove the part that's deviated and shape it, as you can see here. And it's done very meticulously and methodically so you can restore and maintain nasal function. That is so, so critical. And so that's part of the reconstruction and also the harvest to shape it. And you have to maintain the integrity of the nose. Okay, that means you have to keep a strut in place, so at least 15 millimeters. It's very important. And this is then, these grafts are used then to reconstruct the nose. So you've straightened the septum, you've found the cause. Now you're going to release it and restore it. So you're going to take out that part of the septum that's deviated in the back, and that's by the ethmoid and vomer, and then you're going to eliminate that tensioning. Then you're also going to straighten the whole nose in the front, and you're going to straighten it in the back. And then you're going to secure it to doing that, and you're going to secure it in the middle. And so here is that deviation in the top and the bottom of the nose. You're going to take that off, and you can see that in this beautiful intraoperative illustration where the nose, the septum is deviated, but you're going to straighten it by taking it off, that deviation, and you're going to put it into the midline. That's the beauty of looking at it through an open approach. So you're going to straighten it out and soften it and make it straight. And I think that's what you really want to do. And that's really what this depicts here in this diagram here as well, in this illustration. You're taking off that vertical part of the septum and you're fixing it in place. So then once you fix the septum, then you got to go to the top of the nose and you got to fix the top of the nose. And these are done with clocking sutures because remember, the bone and the cartilages are together to make a straight nose. So this just shows exactly what I'm talking about here, because this lady actually just came see me in follow-up, and she had a very deviated nose, and you can see here she is months post-op, and you can see that she looks absolutely amazing, and she loves her result, and you can see that also in her post-op views. Her nose is perfectly straight, not completely, but perfectly straight to her, and on her face it looks beautiful. She's got a beautiful nose. Her nose is drooping and shaped, and now it's absolutely stunning, and it matches her face. So it's both functionally and aesthetically beautiful. That is the sign of rhinoplasty finesse, and I think that's really what you want to see. And so that should be your outcome. Now remember, when you're doing a nose, you're not only straightening the septum, but you're also restoring or maintaining the airway. And part of that airway restoration is the inferior turbinate. Now, the inferior turbinate is a regulator of airflow, and it rarely, if ever, should be removed or partially. I haven't done a inferior turbinate resection in 2 decades because it's not indicated in most patients. You outfracture it, you manipulate it, you do not remove it. It can cause empty nose syndrome. So it's something that should be avoided because the airway of your nose is the inferior third and the anterior 2/3. That's very important to know. So you microfracture that. That helps you breathe better with a straight septum, because you can see in this diagram, this illustration, it shows that the septum is kicked off to one side and the turbinate on the other side is hypertrophy. That's called compensatory hypertrophy. It's very important. And you microfracture that. You don't do mucosal resection. And it's done very, very meticulously. And you outfracture it and you get a straight nasal airway. And that's, this is illustrated by this procedure that's done with a long Vienna speculum. You're just outfracturing that inferior turbinate. That's the sign of a great rhinoplasty. So let's look at some cases. Deviated nose, high dorsum, significant septal deviation, very large nose, taking the dorsum down, doing spreader grafts, shaping it, contouring it, giving you a nice, beautiful shape and contour. A straight nose, remember, a straight nose is the result of a straight septum. Here she is, several years post-op, beautiful result. She looks great, feels great, and she can breathe so much better. That's the sign of a great rhinoplasty and a great functional and aesthetic result. Another patient, same type of thing, deviation, and bulbous tip. So we strengthened the framework, we straightened the nose, we shaped and contoured her nose. We gave her both a functionally and a beautiful nose, but we straightened her septum. So I think the big thing to understand is that surgery is very complicated. Rhinoplasty is the hardest procedure we do in all of plastic surgery. So the key to a straighter nose is a straight and strong septum. And make sure you maintain the function of the nose as well. And obviously, these are the 10 lessons that hopefully were helpful to you as you go on your journey to find someone to help straighten your crooked or deviated nose. Please leave me your comments and thoughts and in the section on YouTube or in my Spotify. Hopefully you learned something about managing the crooked nose. Till next time.